Yeah, because we can't record this conversation right now, just
Hmm.
in case, okay? Well, hi, I'm from psychiatry. I met you yesterday, remember? I don't know if you remember me. I came to see you for a little while when you were in the ETC.
Mm-hmm.
Okay, so, and I'm just
I'm
here.
Diane Browning.
With Diane.
I
Hi.
saw you earlier with
Is
Dr.
it okay if we
Agarwal.
sit down?
Mm-hmm.
So, how's it going since you were transferred here?
Well, I'm just still waiting to get a hold of Dr. Amandeep regarding a particular medication. It's been quite a bear to get a hold of a couple of doctors regarding a particular medical condition and particular medications. So
Maybe we could answer those
that's what I've been dealing
Is
with that.
that the nilotinib or Tasigna?
I have been dealing with a lot of particular issues and symptoms regarding several different medications that I've been getting prescribed, not to mention weird oddities in what seems like either contact contamination in, I believe, food or beverage, for which it's really offsetting or messing up medications. So that's what I've been dealing with. It's just been really weird.
Okay.
It's been going on for a while.
Since
It is
you
odd.
were here, since you came to the hospital?
It just seems as if it's been going on for quite some time. Yeah. And so
Since you were at home?
well, in terms of contact contamination,
Yeah.
going out to various places for eating out in terms of food out and about in town, and that's been going on for a while. So I'm not quite sure if if there's anything there or if there is anything there regarding contact contamination in foods such as out and about at restaurants out in town, or fast food places, things like that.
And how do they contaminate with the medication that you're taking, that you're saying?
It seems to me as if my WBC
I see.
happens to be high, even in regards to medication that's taken.
Okay. So regardless of the medication that you're taking, it sounds like the WBC is not responding, you mean?
No, it seems as if I've been dealing with a high WBC because of what I believe to be contact contamination
I
in foods at restaurants and fast food places, particular ones in town or in other towns, specific areas for which I generally get out here and there. I currently don't have a car, so I generally go with, say, my mother, or I rely on family for a ride. So I've been dealing with weird, what seems like contact contamination from restaurants and fast food places
Okay.
out and about in town
Okay.
or other towns.
What is the diagnosis that you understand you have right now, and why we're treating you here?
Well, I've had leukemia since 2012, so that's still the diagnosis in
Okay.
general.
Okay, okay. And it sounds like you were saying that the food contamination has somehow affected your white blood cells, but you don't think it's from the leukemia, the high blood cells that you have, the white blood cells?
I believe I've been experiencing contact contamination here and there from literally fast food places, restaurant type places, and also low income dentists as well. Literally. And it just seems like something odd. Anyway,
Right.
that I do believe is real.
Okay, okay. How about the medication that Dr. Sahotra has recommended to lower your white blood cells? What's the name of the medication?
Tasigna, for which I believe that we'll be going over that at some point on,
Do you believe that medication
on the
works for
phone.
your leukemia?
I have utilized nilotinib before Tasigna, and yes, it has worked.
Okay, okay. And have you been taking it since you've been here in the hospital? Have you been taking it every day?
I've been taking it at home, what was prescribed to me and sent to my house. And that's definitely all on record.
Right. Right.
And in the database in terms of what I've been sent, for sure. And in terms of what I was prescribed back in 2012, most likely as well. It could still be in the database.
Yes, it is. It is. But the one that you had, it was old. That's my understanding, correct? That the medication you had at home, was it from 2012 or just most recently they sent it?
I have literally a whole storage of medications that I never throw away. And it's literally old boxes and old containers and whatnot, and I never throw any of that away. And in regards to what's purchased on the internet, there is stuff purchased on the internet, for which my family literally has been purchasing various medications online because they are purchasable in general.
What kind of medications are those, if you don't mind me asking?
Say for example, my dad's been purchasing Tasigna from Indiamart.com, and he also purchases antibiotics because he can. And he's very adamant about keeping me out of his room, and I've brought this up.
Yeah.
Literally to family in general. I brought this up to the law enforcement officers in general, because there is a history of either him or my mother coming into my room and stealing my medications. And yes, it has been painkillers from the past when I was prescribed. And also Tasigna, for which it's Tasigna that was prescribed in 2012 and 2013.
The expiration date on the one that you have right now, is that still current or is it expired?
From Dr. Mehta Sapna,
The one that you're taking at home?
the one that I'm taking at home. There's a current running prescription that I literally have.
Okay. But the actual like the package, when you look at the date of expiration on it, does it say that it's still current or is
Yes.
it expired?
It's current.
It's current?
Yeah.
Okay.
Yeah.
Why would they steal the medication? What do you think is the purpose?
To be quite frank, I believe my family figured out through particular means of observing me, my physiological state or something, that there is Tasigna, literally, that works on bowel obstruction. And so...
Is that true? I don't know.
It's for her disease, not really for...
Okay, not for bowel obstruction, okay. But do you think that that's what they think?
It's a leukemia medication.
Yes.
And I believe that my physiological state was observed and literally analyzed throughout the years since 2012, being diagnosed in 2012. And literally it wasn't just painkillers that was stolen out of my room, it was also cards of Tasigna by my parents.
And your dad is the one that purchased the medication for you?
My parents are literally purchasing medication for themselves online. And I know it's possible, and I know that it does occur, and it can occur with money, and yes, it can. And that is really great. I'm just trying to get at the bottom of something with personal matters.
Do you feel safe at home?
Yes, but then again, my parents are manipulative. So they don't do anything against the law. They're just, specific with me.
What do you think what they want to do? What is their final goal? Or their ultimate goal?
I've been literally watching my dad, his bowel obstruction that he has that he didn't get diagnosed for, but he had the biggest protruding gut, way bigger than mine. Literally, his chest stuck out, the bottom gut stuck out. It was huge, very huge. And so I've been watching that melt away. And then he went and ordered some big puffy jackets to hide it. The fact that his gut is going away completely. From IndiaMart.com to Cigna, and also from stealing my Tasigna from 2012. That Dr. Meta Sapna prescribed me back in 2012.
So let's talk about treatment, right? Because you're here, and my understanding is that you want to have treatment for your leukemia, is that correct?
Yes, and I am waiting on a call, I believe, from my doctor, or getting in touch with my doctor. It might be here, or it might be on the phone. I'm just trying to give it a little time, and it is Dr. Amandeep Sahotra that I am trying to get in touch with. Although I have been told some specifics regarding outpatient and inpatient admitted. So yes, I do understand that. I'm just, I'm not quite sure if he's on shift or if he took a vacation. I'm not quite sure. I was also told that there's so many medical professionals that are on for the next 2 weeks and then might be off. So I'm not quite sure what's going on. But I have a lot of other things that I'm literally in the middle of as well, that I'm trying to be on top of.
So you wish,
Because I've already made statements with the law
okay.
regarding medication that was stolen directly out of my room.
Of here or over there?
Out of my room. In the
In the
high
house.
desert, in the high desert, ma'am.
Okay, okay.
Yes, at my house, for which I stay with my parents,
Right, right.
my eldest brother and my youngest brother, and they all have locks on their doors. That's another one. I don't have a lock on my door like them. It's a very cheap lock, and literally they talk a lot in and amongst themselves in regards to my particular diagnoses they have, and also my medication. And I've heard them talking about it before.
Are you concerned of going home with your medications? Because
I am not concerned.
Okay,
I am just dealing with it.
okay. How would you protect your medication from being stolen?
How would I protect my medication from getting stolen? Well, I do have a small safe,
Okay.
so I could utilize that. I've utilized it before.
Okay.
Other than that, I don't have a car, so in terms of when I go places, it's generally with, say, my mom. For sure, my dad doesn't really give me rides, like he doesn't. And my sister is always doing her own thing. She does art at various local museums, and she's also a professor at a local college as well. And she's also had a previous experience with administrative networking administrative for various casinos.
Okay.
So they do tend to talk a lot, and they get along very well in and amongst themselves. Yes, they do.
Who's the person that makes decisions for you in the event that you can't? If something were to happen to
Well,
you.
I'm definitely the one that makes the decisions regarding me.
Right.
My mom does not have legal, I forgot what it's called, legal, the ability to make choices
Okay, that's good to know.
regarding me. And she's actually asked someone before at Comprehensive Cancer Center if she could literally have that particular right to literally make decisions
In case you
regarding me,
In case you can't.
irregardless of me being there or not. Right, say via the phone, say for example, and I was literally told, no, she can't, and she was literally told, no, she can't, literally due to the fact that I talk coherently, I make sense, I'm logical, and that was literally from social workers at Comprehensive Cancer Center, Palm Springs.
So let's play the devil's advocate. in the event that you can't make a decision because you get into an accident, because, God forbid, something happens to you.
It's still just me that's making the decisions.
I know.
It's just me.
So,
However, point of contact for speaking with my family, my mother is on the
the emergency.
yes, she's in the database, listed as my mother and emergency contact. However, it's literally me that makes the decisions regarding me.
Right, and that's correct, including for the three of us, you know, we make our decisions.
Yeah,
But if I get into an accident where I can speak because I have a tube in my mouth, we always choose someone that we feel comfortable only in the event that I cannot make the decision. If you don't feel comfortable with your mom, would you name anyone in particular? Like your sister or a friend or somebody, you need to have that.
it would most likely be my sister and then also my dad.
Okay.
So
Because, well, and
I haven't given that to them because there has been weird things going on in my personal life, such as my medications getting stolen, and that's not a joke.
Sure, sure. So I am recommending, and I'm working on your behalf. I'm a psychiatrist, so I work on my patient's behalf, on my patient's behalf. So
I brought this up also to doctors yesterday during the initial exam, stomach exam, and the initial blood labs.
Right. So let's say in the event that you don't have somebody documented saying, this is the person that will make a decision in case I cannot speak or my brain, something's happening to my brain, the law in California will go directly to the mother or parents. So it can go to your father or your mother.
For which,
You have-
yeah,
which is
for
okay.
which that does sound natural.
Okay, okay. That's
Yes, right.
Okay.
And then
that's-
my sister also lives there. Right. She gets along really well with my parents. So does my younger brother. Right.
Okay. So, so I am taking little notes just so that I remember. So it sounds like you want to continue with treatment, right?
Yes.
To treat the leukemia.
Yes.
You're agreeing with continuing with Tasigna,
Yes.
the one that we prescribe, not the one that is from IndiaMex.com.
I was informed that that medication isn't something that I can get here. Obviously, that makes sense.
Okay.
I'm just trying to wait on talking to my doctor
Okay.
regarding the Tasigna
Okay.
in general. So I'm just.
And what is your understanding if you were not to take a medication? What is your understanding that would happen to you if you don't take treatment?
I'm sorry.
So what do you understand that would happen to you with the leukemia if you don't take Tasigna?
That the diagnoses could change to a different diagnosis, say acute. I was told that by my doctor,
Yes.
and it hasn't gone to acute to the best of my knowledge.
Right. So, but you know that if you don't receive treatment at this point, it could transform into that, right?
I was told that there could be if I didn't do well on keeping in control of my diagnosis, keeping on top of it, that there could be a change
Okay.
from
CML.
even in the acronym, right?
Yeah.
From CML to something else.
AML. AML, is it?
Yes, AML.
Yeah.
Correct.
So it will be, you're right, it will be from chronic to acute.
Right.
Yeah.
Okay. And your wishes is to continue with Dr. Salpotra here at City of Hope?
Yes.
Okay.
Yes.
Okay. So I think those are also the wishes of everyone else here. The only thing that they require is they're hoping that you follow the recommendations that the doctor tells you. That if you are while you're here, if they tell you take it in the morning, you take it in the morning. Like being adherent to the treatment. Their concern is that if you're not adherent, that something worse could happen. Obviously.
Right.
Yeah. Okay.
Right. The diagnosis changing to
Yes.
a different diagnosis. So from say CML to AML
Yes.
specifically, and that has been talked about.
Yes.
Literally.
Wonderful.
Yeah.
Wonderful. Okay. Have you been?
Via email, I believe even.
Okay. In terms of mental health, I know that you were under the treatment of Dr. Salman, Yara Salman. She saw you 4 times back in 2021. Have you seen any other psychiatrist since then?
No,
Okay. Have you been hospitalized psychiatrically at all?
no,
Okay.
never.
Okay. Have you felt, have you had any episodes where you hear voices, see things? I asked you that yesterday.
No,
Okay. Have you gone through periods in your life where you have so much energy you don't need to sleep, but you
No.
engage in cleaning and doing things?
it doesn't
like
make that doesn't make sense to me.
Right, right.
Because with the diagnoses that I have, fatigue is felt, and tiredness is felt,
Yes.
and that's normality.
Yes.
It's
yes.
normal.
Right. But some patients, that we have, like patients that have bipolar disorder, for instance, they got the highs and lows. Sometimes they have that high energy regardless of how sick they are. Their body, part of the brain, just produces a lot of energy that you are like, you can go high. It's like taking steroids.
I'm generally level-headed.
Okay.
It's been a while since being, immature and young and say going out and drinking or any of that,
And
or
that's part of growing
smoking
up.
cigarettes with friends, and say for example smoking weed
Okay.
with friends.
Right. You said that you still smoke weed whenever you can. You told me that.
If I had money, I would purchase it still, and that is the truth.
Okay, that's fine. Do you have any questions?
I mean, I know that the only thing that you want to hear is from Dr. Salhotra saying that it's okay for you to take the Tasigna here. Is that what you're waiting for?
That, and I'm also waiting to talk to him about regarding a medication called Tasigna 3000
Okay.
as well,
So
for
that's
which
that's the one that he doesn't recommend, though, right?
Yes.
That he says
Yeah.
toxic because of the high dose.
Yes, correct. So I can ask him to talk to you.
I would like that.
Okay.
Yes, because I have never heard anything
Yeah,
negative
you're
regarding the
team.
3000.
Yeah, he's in clinic right now, so that's why.
Okay, so just waiting a little bit longer and I'll be here.
Okay.
Yeah?
Sounds good.
Yep.
And you're taking the Hydrea, which is that green
Yes.
and pink one to lower your
Yeah.
count. Okay. Do you mind if I see the nilotinib, the Tasigna that you're taking at home?
Yes, I do have a card there. It's empty, and that's the new prescription that I'm currently getting from
Okay.
the doctor here. And that's the look of the card too. That's the look of the card versus the older look of the card, for which that was prescribed by Dr. Metasapna. And that opens up not like a flip phone, but like a book.
So these
In
are
general.
all the different ones that you were taking. Okay.
That's also goes with the slips and the printed receipt and all of that. That goes with the new. What I'm going to call it is the new look of the card of Tasigna.
So these are the ones that you ran out of. There's no more of this. Is that right?
Correct. That's
Okay.
that's an old kind from 2012. I was when I was diagnosed, and also 2013.
Okay. And then this is the one that you're currently taking at home?
Yes,
Or, okay.
and that is it.
Okay, it looks like that's the
And I do believe that it is different. I do believe that the medication within the capsule is different.
Uh-huh.
And I am basing it off of waiting for the stomach to shrink to a smaller stomach, like how it's been occurring with my dad, for which he has stolen my medication, and he has been shrinking his waist or making it thinner, making it smaller. It's been melting. It's been going away, the bowel obstruction. And he had the biggest one. Giant chest, giant stomach gut, and my mom does too. And the thing with my dad is he's particular in the sense where, yes, he cares about the family, but he's really just caring about himself. He's caring about himself because he's not even, I believe he's sharing it with my mother for sure. However, he is literally taking, I believe, the majority of it, and he got rid of this giant obstruction, this giant protruded gut, giant chest, giant lower gut. And it's just melting away. It's just going away.
Right. So does he respond to you? What does he answer when you confront him?
He told me to not come into his room. He said I'm not allowed in there because that's his room, literally. And he shares a room, of course, with my mother.
Has he ever said, it is true, I'm taking the medication? Or does he accuses you of being, not making sense or being delusional or anything like that?
He hasn't said that. He hasn't really acknowledged.
Okay.
Neither. He tends to be particular in general. I believe he's manipulative because no, he hasn't stated that.
Okay. And you feel safe living at home yourself?
Well, he has many cars, and he has locks on all of his doors, and he has a very big bedroom with my mother.
What do you do at home all day with them? Do you work? Do you go to school?
I've just been on top of or trying to be on top of my cancer. That's all I've been doing, literally. I'm boring as heck. It's just that's how it is. I watch TV. I've been watching the news. I've been trying to pay attention to, say, stuff's going on with coronavirus, and all of that. And I've heard that it's going away and everything. So that does feel nice and everything. I've just been trying to keep my ear to, the news in terms of anything. Yeah.
And the dose that you're taking at home is how much?
2 in the morning, 2 at night.
2 in the morning. Of the 200 or the 150?
Of the 150, the 200 is something that I've also been prescribed, that I have also tried, and that one didn't melt my obstruction or the giant bowel gut neither, and that's the 200 milligram. That one is completely a medication that doesn't do anything for the giant gut. Doesn't do anything at all.
300 in the morning and 300 at night. Is that? So it's 150 times 2, and 2 in the morning, 2 at night. Okay.
Yes.
Perfect.
Do you believe that you have an obstruction?
Yes.
Okay.
Yes.
Have you gotten any tests that says that you have an obstruction?
I've had previous diagnoses from previous doctors at Arrowhead, and there was a giant team that I'm not quite sure what happened to that particular team of doctors, for which were really good at leukemia. When I was diagnosed, there were what seemed like 10 or 15 doctors that came into my room several days out of the week, and I was there for about a month or so, about a month, and it was a giant team, and I was told that they were literally going to school as well to become doctors, because that's a type of research hospital in which students become doctors through experience through working with doctors, which is so awesome. Yeah.
The x-ray yesterday, it didn't show any obstruction in your stomach. It just showed a lot of stool.
It just showed a lot of stool?
Yes. But no obstruction. So that's good.
Okay.
Yeah.
Okay. And usually obstruction, when you're obstructed, anything you eat, it will come out. I mean, it's like, just imagine like it's closed, so everything that you eat, you vomit back. You won't be able to pass any gas. You won't be able to have any bowel movements. You can get bloated, obviously, because your guts are like just bloated and big.
Yeah, you wouldn't be passing any gas. You wouldn't have any bowel movements.
Yeah, right. Which is why I've been inducing with a lot of vitamin C. I've been forcing myself to have the watery bowel movements, and I've been taking a lot of vitamin C. And this has been something I've been doing at home. And it's been, say, niacin, L-lysine, ascorbic acid, and lecithin. And I've been making a particular hot tea concoction.
Oh, that's the ascorbic acid that you're talking about earlier.
Yeah.
Okay.
And just forcing the bowel movement to occur. Okay. Because otherwise there's a particular sort of bowel obstruction that happens with leukemia that I have actually talked to with doctors from Arrowhead before, who do know how to assess through a stomach exam, and when the stomach is hard, that is a bowel obstruction, in regards to leukemia, in regards to, at the very least, CML, which is what I was diagnosed with.
Okay. So you're taking vitamin C, leucine, and what else?
L-lysine,
Lysine.
niacinamide, and ascorbic acid.
Niacinamide, okay.
Thank you so much for your time.
Thank
I
you.
have to go.
Okay.
Thank you so much.
Thank you. Thank you very much.
Okay. Are you feeling anxious since being here, or?
No, I haven't been feeling anxious. I've just been dealing with the medications and waiting to speak to the doctor, and
She's gonna try to get him.
and there has been a lot of very nice staff, and so I'm not making complaints in really any areas except for, well, there was a particular something that occurred this morning where in which there was a urinary lab testing container, a cup to pee in, and the lady said that I urinated this morning to pee into the cup for a lab test, and I said no, that is not what occurred, and I was literally here all morning, and I would have seen, in general. And then what she also said is in regard to the hats in the toilet that there was also that. She also said that she had, while I was here, she said that she had taken the pee in the hat, dumped it into the urinary lab container, the cup, and literally that I knew about it. And I told her no, that's also that's obviously not what's occurring. That's right. It's obviously not what happened.
Okay.
Right.
Okay.
And so that's something that happened this morning. But
Besides that, everything has been okay.
yeah. But other than that, I'm really just here for waiting to talk to the doctor.
Okay.
Really.
So let me make sure that that he can get in touch with you. I mean, that's what she wanted, I guess. And if I see you, if you're still here next week, is it okay if we follow you? Or?
Yes.
Okay.
Yeah.
Okay. All right. So I am glad that you're feeling safe and good here. And,
Yes.
Okay.
Right. Thank
All
you.
right. You're welcome. Take care, okay?
Thank you. You too.
You're welcome.